Hello, and welcome to Dr. Alex Senior Health Center. I am Dr. Alex, and today we will discuss an important health topic in simple, clear language, including warning signs, common causes, treatment options, and practical steps to protect your health. Let's get started. Have you ever felt a sharp pain shoot from your lower back all the way down your leg? Maybe it started as a dull ache you brushed off. Then one day walking got harder. Sitting through a meal became unbearable. Even sleeping through the night felt impossible. Most people assume it's just back pain. But what if your body is actually warning you about pressure on the longest, largest nerve you have? Today we're breaking down sciatica nerve pain, a condition that, according to the National Institute of Neurological Disorders and Stroke, affects a large share of adults at some point in their lives, and for people over 50, the risk climbs even higher. Left unaddressed, it can quietly chip away at your mobility and independence. Let me introduce you to Robert. He's 54. Robert came into the clinic complaining about a little stiffness in his lower back. He figured it was from yard work. 3 weeks later, that stiffness had turned into pain shooting down his right leg. Then came the numbness in his foot. Soon he was avoiding stairs altogether. And by the end of this video, you'll understand exactly why his symptoms escalated the way they did and what he did about it. Before we go further, if you or someone you love is over 50, this channel is built for exactly this kind of guidance. Hit subscribe now so you don't miss next week's video on spinal health, and tap the bell so you're notified the moment it's live. In today's video, you'll learn what sciatica really is and why it isn't a disease on its own. The 7 warning signs you should never ignore. The most common causes, including herniated discs and spinal stenosis. Relief exercises and stretches you can try at home. Practical home care and prevention tips. Treatment options from physical therapy to surgery. And the one warning sign that means you need emergency care immediately. Stick around because Robert's story takes a turn near the end that you'll want to hear before it's too late for you or someone you love. Let's get started. What is sciatica? Sciatica isn't actually a disease. It's a symptom, a signal that something is irritating, compressing, or inflaming the sciatic nerve. The sciatic nerve is the longest and thickest nerve in the human body. It begins in your lower spine, runs through your buttocks, and travels all the way down each leg to your feet. When that nerve gets compressed, pain can radiate along its entire path, sometimes from your lower back all the way to your toes. Sciatica almost always affects one side of the body at a time. The intensity varies widely. Some people feel a mild ache. Others describe pain so severe it stops them in their tracks. Common descriptions include electric shock-like jolts, deep burning sensations, sharp stabbing pain, tingling or pins and needles, noticeable leg weakness. Recognizing these 7 warning signs early can be the difference between a quick recovery and months of struggling. Let's go through them one by one. Warning sign number 1, pain shooting down one leg. This is the hallmark sign of sciatica, and it's the one most people search for online. The pain typically begins in the lower back or buttock. From there, it travels down the back of the thigh, and for many people, it reaches the calf or even the foot. Unlike general back pain, sciatica pain follows a clear, traceable path down the leg. People often notice it specifically when standing up after sitting, walking for more than a few minutes, getting out of bed in the morning, sitting for long stretches. If pain is traveling from your back into your leg, that's not something to brush off. It's a clear signal worth paying attention to. Warning sign number 2, burning or electric shock sensations. Many patients describe sciatica as an electric shock running down the leg. Others describe it as a deep burning ache or sudden sharp stabbing pain. These sensations usually point to nerve irritation rather than a simple muscle strain, and that distinction matters for how it's treated. Watch for pain that flares up when you sneeze, cough, laugh, bend forward, lift something heavy. Warning sign number 3, numbness or tingling. Another telltale sign is numbness, that pins and needles feeling, or a noticeable drop in sensation. It commonly shows up in the foot, toes, calf, or outer leg. This happens because the irritated nerve isn't transmitting signals properly anymore. If numbness lingers for more than a few days, that's worth getting checked by a healthcare professional. Don't wait it out. Warning sign number 4, muscle weakness. Sciatica doesn't just affect how things feel, it can affect how your muscles actually function. You might notice difficulty lifting your foot when you walk, weakness climbing stairs, trouble standing on your toes, or your leg unexpectedly giving way. This kind of weakness suggests the nerve compression is now affecting muscle control, not just sensation, and it's a sign you shouldn't ignore. Now here's where Robert's story takes a turn. Around week 4, he noticed his right foot was starting to drag slightly when he walked. He still thought it would resolve on its own. It didn't, and what happened next is exactly why warning sign number 7, later in this video, matters so much. Keep watching. Warning sign number 5, pain that worsens while sitting. For a lot of people with sciatica, sitting is the worst position of all. Long car rides become unbearable. A full workday at a desk feels impossible. Why? Sitting increases pressure on your spinal discs and nerves more than standing or walking does. Interestingly, pain often improves with gentle movement. If sitting consistently makes your symptoms worse, that's a strong clue sciatica is behind it. Warning sign number 6, pain during certain movements. Certain movements put extra pressure on the spine and can trigger a flare almost instantly. Bending forward, twisting at the waist, heavy lifting, sudden jerky movements, coughing or sneezing. If you've started avoiding these movements out of fear of pain, your body is telling you something real. Warning sign number 7, loss of bladder or bowel control. This is the most serious warning sign on this list, and it's the one we promise to come back to. If you suddenly experience loss of bladder control, loss of bowel control, rapidly worsening leg weakness, or numbness around the groin or inner thighs, this is a medical emergency. These symptoms can point to a condition called cauda equina syndrome, a rare but serious complication where the nerve bundle at the base of the spine becomes severely compressed. According to the American Association of Orthopedic Surgeons, cauda equina syndrome requires emergency treatment, typically surgery, within 24 to 48 hours to have the best chance of preventing permanent nerve damage. This is exactly what happened to Robert. 3 days after his foot started dragging, he woke up and couldn't feel his inner thighs. He went straight to the emergency room. Doctors confirmed cauda equina syndrome and operated within hours. Today, Robert is walking normally again, but he's the first to tell you that waiting even one more day could have changed that outcome permanently. If you or anyone you know experiences these symptoms, do not wait. Go to the emergency room immediately. Common causes of sciatica. Several underlying conditions can compress or irritate the sciatic nerve. Understanding the cause matters because it shapes the right treatment path. Herniated disc, the most common cause. A spinal disc bulges or ruptures and presses on a nearby nerve root. Spinal stenosis, a narrowing of the spinal canal that puts pressure on nerves, more common as we get older. Degenerative disc disease, natural age-related wear and tear on the discs that cushion your spine. Bone spurs, extra bone growth, often from arthritis, that can press directly on a nerve. Piriformis syndrome, a muscle deep in the buttock that irritates the sciatic nerve as it passes underneath or through it. Injury or trauma, falls, accidents, or sports injuries that damage or compress the spine. Prolonged sitting, extended sitting, especially with poor posture, can worsen symptoms over time. Sciatica relief exercises you can try at home. A quick note before we start, always move gently and stop immediately if any exercise increases your pain. Exercise 1, knee to chest stretch. Lie on your back. Gently pull one knee toward your chest. Hold for 20 seconds. Repeat 3 times on each side. Exercise 2, seated piriformis stretch. Sit upright in a sturdy chair. Cross one ankle over the opposite knee. Lean forward slowly. Hold for 20 seconds, then switch sides. Exercise 3, cat-camel stretch. Get on your hands and knees. Arch your back upward, then gently lower it. Repeat 10 times at a slow, controlled pace. Exercise 4, gentle walking. One of the safest, most effective activities for many sciatica sufferers. Start with short walks and gradually increase your distance as tolerated. Home care tips for sciatica relief. Avoid prolonged sitting. Stand and move every 30 minutes. Maintain a healthy body weight to reduce spinal pressure. Use proper form when lifting. Bend at the knees, not the back. Sleep on a supportive mattress and try sleeping with a pillow between your knees. Apply heat or ice packs to manage flare-ups. Stay physically active within your comfort level. Work on posture, especially if you sit for long periods. Stretch regularly, even on pain-free days. Avoid sudden twisting movements. Stay hydrated and keep moving throughout the day. Treatment options. Treatment depends entirely on the underlying cause, and most people respond well to non-surgical care. Options include physical therapy and targeted strengthening, anti-inflammatory medications, muscle relaxants, nerve pain medications, steroid injections, lifestyle and ergonomic adjustments, surgery, reserved for severe or emergency cases like cauda equina syndrome. The encouraging news: most patients improve significantly with conservative treatment and consistent rehabilitation.